So I want to make sure that Medicaid and insurance companies are paying for doulas and midwives. They're paying for birthing centers.
If people had access to doulas, this would also help a lot of people. And you spoke about that. What is it that makes you so intrigued by the doula concept? Many people are unwilling to talk about it.
Yeah, well, look, healthcare is expensive. And it's also not as accessible as it once was, right? Especially if you live in rural Georgia. Going to a hospital, if you're in Southwest Georgia, may require an 1.5 or 2 hour trip. And if you are pregnant and you need to go to the hospital, if you live in downtown Atlanta, that's a 5-10 minute trip. If you live somewhere in Southwest Georgia, it may take you an 1.5 hours. And that may be the difference between life or death for your baby or for you. So what I want to make sure we do is that we have providers who are more flexible, more mobile, more affordable, to ensure that moms across the state are receiving the maternal health care that they need. So I want to make sure that Medicaid and insurance companies are paying for doulas and midwives. They're paying for birthing centers, which is different from hospitals, but provide the same kinds of supports so you can give birth safely, so that people have access to the basic services that they need. So shout out to all the doulas and the midwives out there, because you are part of an ecosystem that we need to continue to grow if we want to make sure that mothers are able to give birth safely in this state. And look, the fact of the matter is, because of the lack of expansion of Medicaid, because of the closures of rural hospitals, because of the abortion ban, and the fact that there are a lot of OBGYNs who don't want to practice in this state, there are a lot of counties in Georgia that don't have OBGYN services. They don't have labor and delivery services. So we need to be creative and make sure that we're using the tools that we have available to us. And doulas are the perfect example of something, of a profession that's been around for hundreds, thousands of years, that we should be utilizing more in a state like Georgia.
Are you willing to say that you're going to do the best you can? I like to say it this way: the best you can to let insurance pay for doulas, because right now it's completely out of pocket.
Absolutely.
Okay.